With the high rates of drug abuse in the world today, it is so important that people have an understanding of what drug exposure in kids and teens can look like. Know why or how these kids and teens become exposed, and have a toolbox for how to step in and help. Sometimes kids and teens begin using drugs that are used by their family members or others who are close to them. Sometimes they get drugs in their system just by being around them without actually using them. This makes them behave in unusual ways. If use or exposure happens over a long enough period of time, their body can get to where it needs to have the drugs. And if they stop or are no longer exposed to it, it can make them behave in other ways. These behaviors may make you feel frustrated and unsure of how to respond. Those feelings are normal. Working with kids and teens exposed to drugs is hard work. Always remember, people, especially kids and teens, are like icebergs. We see the behaviors and the moods on top, but very little of what's going on underneath. If the behaviors are caused by using drugs or being exposed to drugs, they could lessen after a few days or weeks. If they are not caused by drugs, they're more likely to continue. Here are several types of drugs and the effects that they can present. Methamphetamine, or meth, is a stimulant. Stimulants speed up the messages between the brain and the body. They often make people more awake, alert, confident, and energetic. Meth is made of common hazardous ingredients and is often inhaled, smoked, snorted as a powder, or injected with a needle and syringe. Children can be exposed through smoke in the air or residue on surfaces. Some drug-using family members have been known to inject children as well. Marijuana is from a plant and can be smoked or eaten. It is a type of drug called a hallucinogen. Hallucinogens can change someone's perceptions of reality and change their moods. There is new research linking marijuana use to mental illness. Children and teens can be exposed through smoke in the air or residue on surfaces. Cocaine or crack, like meth, is a stimulant. Stimulants speed up the messages between the brain and the body. They often make the body more awake, alert, confident, and energetic. Cocaine can be taken by snorting, injecting with a needle and syringe, or smoking it. It comes in different forms: powder cocaine and crack. People take more and more to feel its effects because their body builds tolerance to it. Kids and teens can be exposed through smoke in the air or residue on surfaces. Opioids are depressants. Depressants are drugs that have a calming effect on a person. They slow the messages sent between the brain and the body. In this section, we will briefly describe common depressants. Some examples include morphine, heroin, codeine, fentanyl, Oxycontin, Lortab, and hydrocodone. Opioids exist naturally in the body. However, opioids that are usually misused are medicines that treat pain, and some are only used as recreational drugs. Opioids can be taken as pills, snorted, and smoked, but are often injected using a needle and syringe. People have to take more and more to feel its effects because their body builds tolerance to it. Children can be exposed through smoke in the air or residue on surfaces. Some drug-using family members have been known to inject children as well. You may not be able to tell whether or not a child, preteen, or teen in your care is using drugs. There is no one way for a person to act while using drugs because they have lots of different effects. However, caregivers should know the most common warning signs of drug use. This list of behaviors do not always mean drug use, but they can. These behaviors can also be linked to their experiences they have had in foster care or in an unsafe home. Learning about the child and teen and gaining their trust will help you to know what's going on with them. Remember the picture of the iceberg. There may be many reasons for the behaviors and feelings, and providing a safe, stable environment is very helpful. Many different things may lead to a child or teen using drugs. There is no one cause. However, we do know that some life experiences can predict drug use. To review this material in greater detail, view our document on drug use in kids and teens, linked in the description below.